All right, so now in chapter 2, we will talk about personal health records. There are a variety of PHRs in the world today. They range from handwritten pieces of paper to highly sophisticated electronic applications. So they also range in format and interoperability. So there's paper-based, personal computer-based, web-based, hybrid, desktop, web-based, and also mobile devices. Paper-based continues to be utilized by patient. These PHRs consist of folders and notebooks of filled with information from the physician's practices, hospital pharmacies, as well as from the insurance companies, and ancillary centers, as well as laboratories. Personal computer base include reports or scans, health information documents that's stored on a tablet, laptop, or desktop computer. Web-based is obtained through private online accounts that's accessed through the web browser. Patients can log in to their account with a unique username and password. Web-based platforms can include video conferences for telemedicine, document sharing with provider who have been granted permission, and secure emailing. And then you also have hybrid desktop web-based, which offers the flexibility of uploading health information upon the web server. Patient uses a personal desktop or a laptop computer to maintain his information or her information or their information on the web server. Mobile devices acceptance and use among the portable devices used to house the PHR, and this allows the patient to easily carry their personal information wherever they go. Okay. Now the style and content depends on the setting in which the healthcare services are provided. Regulatory and accreditation requirements for the various healthcare settings are quite different as are reimbursements requirements, patient demographic, and service mix. Documentation requirements for acute care facilities are unique in the settings, and different types of acute care hospitals must comply with different specialty documentation requirements. For example, the documentation for diagnostic and therapeutic services, care of development disabilities, and counseling for behavioral conditions are somewhat different from the documentation for acute care medical surgical services. So let's talk about the future of clinical documentation. So where is it going? Although healthcare has historically been behind, and they've been lagging behind other industries in the application of information technology, the advancement of the EHR have saturated the healthcare environment. As mentioned in chapter 1, if you all read chapter 1, the evolution of computer-based systems and acute care facilities began with the development of automated system for administrative operation, such as the admissions department, billing, and claims processing. So the future of the clinical documentation involves artificial intelligence through the use of natural language processing. You may hear people call it NLP, and also predictive modeling. not only in the acute care setting, but also in the outpatient setting. There is importance in the clinical documentation and the system's ability to capture the documentation or assist through the use of disease for application for predictive modeling, right? Or predicting the documentation to ensure quality indicators are documented. So HIPAA is driving the universal adoption of EHR systems. HIPAA regulations adopted code sets for reporting diagnosis and procedures that are used in all transactions for billing services. And these are called out and they're listed here. So ICD-10, Healthcare Common Procedure Coding System, CPT, CDT, and NDC. So take a look at those in your book. The future of clinical documentation, when we look at National Health Information Network, this is a group of federal agencies and non-federal organizations that came together on a common mission and purpose to improve patient care, to streamline disability benefit claims, and improve public health reporting through secure, trusted, and interoperable health information exchange. So the Office of the National Coordinator for Health Information Technology led the establishment supporting HIE across the United States. The ONC has said these priorities for HIE are to set clear goals for health information exchange and measure of success, to develop policies and standards that can solve interoperability issues and reduce the cost of adoption, and also to ensure patients remain at the center of their health information exchange and have access to their electronic health information. The Health Level 7, HL7 International, which is a nonprofit organization that develops standards for interoperability for health information technology. They was founded in 1987. This global authority has affiliates in more than 30 countries and members and 55 countries. Okay, HL7 is an ANSI accredited standard development organization. They are dedicated to providing a comprehensive framework and related standards for the exchange, integration, sharing, and retrieval of health information that supports clinical practices and the management, delivery, and evaluation of health services. The systemized nomenclature of medical clinical terms, SNOMEDs, CT, they provide a common language for indexing, storing, retrieving, and aggregating clinical data across specialties and healthcare providers. SNOMED CT is a comprehensive clinical terminology originally created by the College of American Pathologists, and as of April 2007, they have maintained and distributed by the International Health Terminology Standard Development Organization, which is also a nonprofit organization in Denmark. And then the National Council for Prescription Drug Program, the NCPDP, creates and promotes data interchange standards for the pharmacy services sector of the healthcare industry. So Medicare has mandated prescribing for Medicare plans to reduce prescription errors due to illegible handwriting. So, as stated, they create, promote data interchange standards for the pharmacy service sector of the healthcare industry. So, take a moment, take time, read those chapters, read that information. Good stuff. Is information that you would need to know because all of this information just build upon each other. So, this ends chapter 2.